We often hear the phrase, no pain, no gain, but if the pain persists, how do you know if you're doing more harm than good? In this video, I'm going to reveal why pain can be your ally, as long as you avoid the 5 biggest mistakes that many of you are unknowingly making.
Please subscribe.
Dr. Boisvert, Canadian chiropractor, to explain why this is so important. Pain is a complex and subjective experience that plays an important role for all of us. It keeps us away from injury and danger. Persistent pain comes at a huge cost to society with impressive medical expenses. But unfortunately, there is a lot of misunderstanding about what pain is. Before clarifying the things to avoid, let's clear a few things up. When you feel discomfort that turns into pain, you may gradually become more irritable. Everything becomes more difficult, thinking, sleeping, focusing on anything other than the pain. Which raises an interesting question. Do you think pain is in our head, in our body, or is it a bit of both? We know that pain, most of the time, starts with a stimulus. Something in the back, at the base of the neck, a pinch, whether after a bad movement or physical overload. What's happening in your body isn't the pain itself. There are receptors in our skin, in our tissues, called nociceptors, that detect different types of stimuli. They can detect temperature, pressure, and pH changes, for example, due to inflammation after a traumatic event. These nociceptors send signals through highly specialized nerve fibers. The delta A fibers are responsible for acute pain, like when you stub your toe or touch something very hot. Others, called C fibers, are much slower and responsible for dull and lingering pain. These signals travel up to the spinal cord, where they're slightly modified and then reach the brain. Essentially, these are just electrical signals, electrochemical impulses, and this must absolutely be distinguished from the subjective and unique experience of pain. Because our emotions, memories, and interpretations, essentially our present and future actions, have the power to shape our unique experience with pain. Currently, the best scientific evidence continues to show that a certain level of pain is necessary to reduce nociceptive signals more quickly. However, for this to work, it's essential to be in control of the situation, in other words, autonomy, with a more objective and positive view of the pain. Therefore, the first mistake many of you will make is looking for answers on Google. Most of the articles that appear at the top of search results are often misleading showcases designed to catch your attention with popular keywords. The top references on Google use clickbait, with general symptoms that many of you will identify with. Even worse, they sometimes mention serious but extremely rare conditions, which only fuel your anxiety and distort your perception of pain. From there, it's no longer just a painful sensation. It's pain amplified by fear and anxiety, which further distorts your experience with it. Moreover, considering that the majority of musculoskeletal episodes occur without trauma, in an idiopathic manner, there's nothing stuck, displaced, damaged, inflamed, or hidden. Many often forget that pain can simply be a component of your body that is more sensitive, something invisible to medical imaging, primarily encouraging preventive actions to protect your health. Another common mistake is being voluntarily or involuntarily limited in your vocabulary for pain. These are patients who don't differentiate between tension, discomfort, stiffness, soreness, and for whom everything is labeled as pain. Not being able to be more objective, such as observing how it reacts to certain positions, changes in posture, walking, specific movements, or different times of the day, is crucial for creating a detailed map that will allow your brain to regain control more quickly. This also helps healthcare professionals better understand the situation and propose more appropriate treatment options or recommendations. Contrary to what many of you might think, we take discomfort or pain just as seriously, whether it's at 3 or 9 out of 10. But the contextual elements surrounding it are much more important than the intensity itself. A lack of objectivity is problematic because it can alter the neural pathways of pain, leading to faster and more intense signals over time. But it can also open the door to bad health choices, notably through overdiagnosis. Medical tests could be suggested awkwardly, detecting a multitude of completely benign anatomical anomalies, which, if left alone, would never have caused problems. However, once discovered, they can add unnecessary weight to your medical backpack, progressively decreasing your autonomy and giving you a falsely negative view of your health. Using non-steroidal anti-inflammatory drugs to relieve neuromusculoskeletal pain is also a frequent mistake many of you make. On the one hand, because it assumes there's always inflammation, which, as you now know, isn't always the case. Moreover, these medications could dull pain signals of inflammatory origin, prompting you to continue harmful actions or movements without knowing it, potentially prolonging nociceptive mechanisms for days, weeks, or even months. If you still decide to take medication, Canadian recommendations suggest using it short-term and only if it provides significant pain relief, usually over 40%. Given that neuromusculoskeletal pain improves progressively with movement, it would be wiser to reserve this type of medication for the evening to prevent certain positions or involuntary movements from disturbing your sleep. Rest plays a crucial role in pain management. A tired, irritable, and pained person will have much more difficulty tolerating their condition and may lack the energy to actively participate in their recovery. Another common belief is that if you avoid moving, doing uncomfortable activities, and get some rest, your condition will rapidly improve. This behavior is linked to what we call yellow flags, psychological or social factors such as stress and anxiety, or in this case, negative thoughts about pain. Avoiding certain positions, movements, or activities out of fear of making things worse without giving yourself the opportunity to gradually reintroduce them based on your tolerance can hold you back. Over time, this avoidance can turn what limits you today into a bigger issue down the road, which brings us to the biggest and most frequent mistake: thinking that if it still hurts, it must not be healed. These are patients who, even 2 years after the onset of a itis problem, tendinitis, bursitis, capsulitis, or something else, blame their regional sensitivity on an unhealed injury. The body has an incredible ability to self-heal, capable of repairing damaged tissues and gradually restoring function. However, it's possible for pain to persist even after full healing. Pain can be due to various factors such as pain memory in the nervous system, persistent nerve sensitization around the injury, or simply our thoughts. But above all, negative behaviors throughout our recovery can affect our experience with pain. In these cases, the pain isn't a sign of an unhealed injury, but rather a manifestation of these changes, often requiring a long-term approach to chronic pain self-management. If there's one key takeaway from this video so far, it's that just because something hurts doesn't mean it's harming you. It's perfectly okay to poke the pain to find your temporary limitations, with the goal of progressively desensitizing yourself over time. If you want to regain control, stop constantly thinking about fragility, injury, or a defect when you're in pain. It's important to have a more positive, objective attitude working around the pain to allow for optimal home rehabilitation, which, over the weeks and months, will make your pain more tolerable until a possible complete cessation of the protective mechanisms around it. Share your story, comments, suggestions, or simply ask if you still have questions. Because an informed person is a person in control of their health.